Very good morning to all of you. Welcome to the Medical Legal Conclave of Akriti. Akriti is a group of 18 friends who wants to do something different, not only sitting in a kitty and eating and chatting. In that way, the Akriti has come in front of you with the breast saga 6 months back, and today here we are with the Medical Legal Conclave, which is today is the burning topic for all of us. We are wearing a sari which is not white. Why? Because the white color of a doctor is become red with the blood of red and become little bit dirty with the why? Who is at fault? Whether we or the society? I think somewhere us, because we don't go to the society and tell our part. Because of that, today's the Medical Legal Conclave is bridging the gap with the society, with the lawmaker, with the policy makers. And my request to each of you, very much in time, very crisp message to everyone. And the extra talking is a main culprit. What you talk unnecessary in front of the patient, what your staff talk, and this sometime take you to the court. So learn here first thing to give the crisp message, precise message, follow the protocols, follow the SOP and document everything.
Good morning, friends and esteemed experts. So we will be talking about POCSO Act, what a gynecologist should know. India has the dubious distinction of having the world's largest number of sexually abused children, with 1 in every 10 children sexually abused at any point of time. So what is POCSO Act? POCSO Act was enacted for the protection of children from sexual offences. The Act is a comprehensive law to provide for the protection of children from the offences of sexual assault, sexual harassment and pornography, while safeguarding the interests of child at every stage of the judicial process by incorporating child-friendly mechanism for reporting, recording of evidence, investigation and speedy trial of offences through designated special courts. So this act was, in 2012, it has come in force with effect from 14th November and amended in 2019. An act to protect children from offences of sexual assault, like I told before, and such offences and for matter connected there with penetrative sexual assault, aggravated penetrative sexual assault, aggravated sexual assault and sexual harassment. So POCSO Act defines child as a person under the age of 18 years. It criminalizes all forms of sexual assault and not merely penetration. Watching or collecting child porn is also an offense under this law. Abatement of child sexual abuse is also an offense. Under Section 20 of the Act, it is mandatory for the hospital or the employees to report the case. Criminalizes consensual sexual intercourse between two people below age of 18. While I was making the presentation, I was very impressed by the people like Prayas organization, the CRY Foundation and the National Health Survey, who have done a lot of work in making this act. Dealing with a pregnancy in a minor girl. In clinical practice, an obstetrician or a medical person is likely to come across situations when medical examination is ordered as a procedure under law, when patient comes to him or her for any complaint and discovered to be pregnant patient is minor and comes for ANC registration. So what about the examination and information? It has been told in detail by Dr. Anita. The examination will be done as per provisions of Section 164A Code of Criminal Procedure. That is provisions for the examination of rape victim and provisions of Section 27 of POCSO Act. The said Act makes provisions for the medical examination of the child in a manner designed to cause as little distress as possible. It is very important. The examination is to be carried out in the presence of parent or other person whom the child trusts, and in the case of a female child, by a female doctor. We will have to follow section 19(1) of POCSO, which states that any person who has apprehension that an offence under this act is likely to be committed or has the knowledge that such an offence has been committed, he shall provide such information to two organizations, the Special Juvenile Police Unit or the local police. Now section 19(7) further says that no person shall incur any liability, क्योंकि हम लोगों को बहुत डर लगता है information करने में. So no person shall incur any liability, civil or criminal, for giving information in good faith for the purpose of subsection 19. Punishment for failure to report shall be punished with imprisonment of either description, which may extend to 6 months, or with fine, or both. So very important to inform. This implies that there is a legal responsibility not only on doctors, but on everyone to report a minor girl who is found to be pregnant to the Special Juvenile Police or local police. The marital status of the patient does not change the liability to inform to police. So in the morning, the IPS officer told us that you should be informing even the teachers or the principals of school are liable under this act. So a minor girl, married, unmarried, walks into your consulting room and you find her to be pregnant. Confirm the age by Aadhaar card or any other ID card. Do not refuse medical services, investigations, treatment to the patient. It comes under law. Examine, investigate only after the consent of the child and guardian or the parent. Inform Special Juvenile Police Unit, as I told you earlier. If patient wants to continue pregnancy, treat her according to routine protocol. These were the FOXI guidelines which were there in 2021. So responsibility, if there is indication of MTP, then take consent of parent or guardian of the minor, and then you may terminate the pregnancy and following all the rules of MTP Act. Preserve the product of conception, which is very important in normal saline, and inform police and hand over them if they want to take with proper documentation. So thus, whenever a minor girl comes to your clinic who is pregnant, is our legal responsibility to inform juvenile police court or local police under POCSO Act. We do not incur any civil or criminal liability for giving information in good faith. We should follow the law of the state, at the same time do our duty of providing medical services to the patient. Less than 18, now there are certain clinical situations where, this is my experience because many times I get phone calls from my own friends. Less than 18 years old, married woman comes with pregnancy. All these questions are related to you, so you will have to answer them. Less than 18 years old married woman comes with pregnancy. She's 18 years old with 9 months pregnancy. Do you inform? So at 17 she was, had a sexual intercourse. So 17-year-old with ectopic pregnancy. Do you inform? 16-year-old with biochemical pregnancy. Do you inform? And 14-year-old boy comes with mother with history of sexual assault. What should we do? So these questions are for the experts. Here, just 2 minutes. FIR to be lodged as per different sections of Act. In case victim is a girl child, the examination should be done by a lady doctor. These were the amendments. The examination should be conducted in presence of parent, guardian with whom child is comfortable, or any person deputed. If both are not there, sometimes the girl is alone. So the head of the medical institution can put any person, a responsible person there for the presence. And all emergency medical care has to be given if the victim needs to. Emergency care should be provided in presence of the guardian or this, and no legal or magisterial requirement is needed to start emergency medical care. Take care of cuts, bruises, or other injuries, and this is a very important treatment for exposure to sexually transmitted diseases, including prophylaxis should be given, and treatment and prophylaxis against HIV has to be considered. Possible pregnancy and emergency contraception should be discussed with the child who has attained puberty and her parents or guardian in whom the child trusts. Whenever necessary, seek proper psychological counseling for the minor. Any forensic evidence collected in the course of giving medical care should be properly collected in accordance with the section 27 of the Act. And consent is very important, and if they refuse informing, police is mandatory. For emergency treatment, don't wait for the police. Consent should be informed and well explained and in the language they understand. The police personnel should not be present at the time of the examination. Do the examination in a non-judgmental way and with empathy. These are the do's and don'ts, and just as one slide that 1 out of every 2 children in India is sexually abused, and most never report it. 52% of the cases are boys. Thank you so much, and all questions to the expert panel.
Thank you, Dr. Chandan.